Let me know if anything makes you feel uncomfortable, okay?
Yes, ma'am.
All right, Mr. Cray.
Reverend Cray, actually.
Okay, Reverend. How old is Lindsay?
14. Now, how long was this going to take? And I'm only asking that because we got to get down to Cedar Rapids. I'm preaching at a revival meeting tomorrow.
Okay, we'll just figure out what's going on here first and take it from there.
Have you ever felt pain like this before?
Her last pregnancy, she'd get sick like this, but not with all this blood.
Last pregnancy?
Lindsay, what happened with your last pregnancy? Did you carry to term?
She'd had what they called a spontaneous miscarriage. That was 4 months ago.
Well, it doesn't look like she's pregnant now. However, I am seeing some irregularities in the lining of her uterus. Perhaps something that didn't move through when she had her miscarriage. All right, I'm gonna do a pelvic exam now. Are you all right with that?
You can come outside. There's a waiting area. We'll give your daughter a little more privacy.
My daughter? Lindsay's my wife.
This marriage is legal? That guy and a 14-year-old girl?
Her father gave us consent, and a judge signed off on it, so yeah.
What about her mother?
Now, she died when Lindsay was only 3.
That man should be arrested.
Right, but on what charges?
Rape, coercion, whatever. This girl is a kid. She obviously had no choice in the matter.
He barely lets her speak. Can we call in the police? Family services?
Well, unfortunately, we're required to respect Michigan state law.
How's the girl doing?
She's undergoing a DNC to get rid of any products from her prior miscarriage.
Yeah, which the Reverend only okayed because he wants Lindsay to be able to conceive as soon as possible.
I realize this is distasteful for all of us, but I implore both of you to do your best not to let your personal feelings interfere with the care of this patient or the law.
Hi. How are you feeling, Lindsay?
I'm a little groggy still, but I feel better. Thank you, ma'am.
Is everything okay with her?
Well, that's what I came in to discuss with you both. The gynecologist found a tumor growing within the tissue that would have become the placenta.
Tumor?
Yes. She sent it to pathology. It is, I'm afraid, malignant. It's called a choriocarcinoma.
I have cancer?
Thankfully, it's still confined to your uterus. That's what's called stage 1. Given that we caught it relatively early, these tumors generally respond favorably to chemotherapy.
And if that doesn't work, what happens then?
Worst case scenario, we would need to consider a hysterectomy, but we are far, far from even discussing that.
See, first she comes in here, talks chemo. Next, she's scheming to remove your womb altogether.
I can assure you there is no scheming going on.
Chemo can lead to infertility.
Not necessarily. Yes, there are some risk factors, but to do nothing at all would be far, far riskier.
No, thank you, then. We will not be doing any chemotherapy.
Sir, I'm going to ask you to step out for a moment so that I can discuss this with my patient privately.
Why? She doesn't want me to leave. Go on, ask her.
He can stay.
Like I said, only thing we need from you now, doctor, is to get Lindsay discharged.
I'm not sure I should be talking to you alone.
Is that what he told you? Listen, I'm not sure how you feel about being married, but the one advantage that it does give you is that you are considered by law to be medically emancipated.
Emancipated?
It means you have the right to make your own medical decisions.
Does chemo really make it so I can't have a baby?
No, and Lindsay, it's clearly your best and safest bet in moving forward.
What are you doing?
Nothing.
I was just conferring with my patient. Lindsay, regardless of what this man thinks or wants, it is your body and your choice. So what do you want to do? Forget your hands
From the
off
start,
of me.
you have been willful and argumentative.
My patient has the right to decide how she wants to treat her cancer.
Cancer is you. You've been treating Lindsay like she's a child,
She
not a woman.
is a child. She's 14.
Just because you had some judge sign off on what's obviously a case of
I need to
abuse
talk to
does not
somebody in
magically
charge here.
decree her a woman. And now you want to play games with her health? You are a bully and a predator.
I'm the charge nurse, sir. How can I help you?
Yes, I want this bitch removed from my wife's care.
You're absolutely right. And again, I want to apologize for Dr. Manning's behavior. It was entirely unprofessional.
Very aggressive, it was pushy.
Yeah, well, between you and me, this is not the first time we've had a problem with her. She can get emotional. Women, right? I have to check up on a patient in orthopedics. Monique, help Reverend Cray here with discharge paperwork, would you? Patient's name is Lindsay Cray. Monique will take great care of you. Good luck and God bless, Reverend. I will be praying for you and your wife.
Thank you.
You're very welcome.
Where's the Reverend?
He's filling out the paperwork needed to take you out of here. I can't keep you here much longer. I know you have some big decisions to make, but I won't be able to get you the medical attention you need unless you speak up right now.
My mother died when she was 19. She had ovarian cancer. My great-grandmother, too. Guess it's the family curse.
I'm sorry to hear that.
The lady doctor said something earlier about a hysterectomy.
Dr. Manning, yes. Now that is only if you get sicker. With the right medicine, you have a great chance of beating this. You can live a long life, have a family someday.
Are those things I'm supposed to look forward to? No, I want a hysterectomy.
A hysterectomy is really not necessary at this point.
I don't care. Some women have their breasts removed if they have the cancer gene just so they don't get it later, right?
But you are so young. A hysterectomy is irreversible. You will not be able to become pregnant and have children, ever.
You don't know my life. You don't understand. I don't want to bring a kid into this world. Dr. Manning said it was my decision.
What is going on here?
Lindsay has decided to have a hysterectomy.
Over my dead body. She is my wife. I make the decisions.
Sir, please move.
You lay so much as a finger on her, and I will sue you to kingdom come.
We have her consent.
You lied to me. She can't make that kind of decision for herself. She was obviously coerced. He forced you to sign this, didn't he?
No. It was my decision.
You have 2 seconds to step aside, Mr. Cray, or I will have you forcibly removed from the premises.
You go through this, Lindsay, and you will be banished by the church, the community, everything. You will be diminished in the eyes of the Lord. Do you understand?
Hi, I'm Dr. Halstead. Vasily Kipkakli. Butchered it, didn't I?
You got close. Just call him V. It's easier. I'm his cousin, Brandon Wyckoff.
Nice to meet you. So, V, what happened?
He's visiting me from Moldova. He knows like 10 words of English.
Yeah, that's okay. We can get a translator.
Oh, good luck. Most people there speak Russian or Romanian. He's from the south. He speaks Gagauz. It's just better if I do the talking. Long story short, he fell in the shower.
All right. Look at the back of your head. Minor head laceration. Doesn't even need a stitch. Yeah, there you go. Anything hurt? Pain?
Oh, I okay.
Okay, good. want to get an x-ray, but I think the arm is just bruised.
There's nothing internal.
I'm not seeing anything concerning.
Oh, thank God. If he's a no-go, I'm screwed.
Sorry?
Oh, that came out wrong.
Fistula for dialysis. End-stage renal disease?
Yeah. My only hope is a new kidney. Luckily, V's donated me one of his. I love you, cuz.
Patient's middle name.
Is that really necessary? I never put mine on anything.
Okay. Date of birth.
I don't know. I'm 30. He's a year younger than me, maybe 2.
Everything okay?
The intake form has a few blank boxes.
More than a few.
Look, the paperwork is irrelevant. I'm covering the costs.
Billing is still going to want information.
Cash is king. I'm sure they'll make an exception. Are we done?
Thanks, Leah. Kind of shooting the messenger, don't you think?
I'll buy her something from the gift shop. V's x-ray?
No fracture.
Great. We can go. Oh.
You all right?
I'm exhausted. Kidney failure will do that to you.
I bet.
Transplant is next week at East Mercy. I'm supposed to be resting and keep my stress level low. I brought you to Chicago to cure me, not make it worse. Sorry. Let's go.
Hold on. Let me take a look at you first.
I really am okay. I have my own nephrologist. He'll make a house call.
End-stage renal disease, I suspect they'll just send you to an ED for labs.
Yeah, you're probably right. That's been the drill. All right. But I want my doctor in the loop. I'll have my assistant reach out to the hospital and set everything up.
Works for me. I'll send someone in to get you registered.
I'm gonna stay.
Dr. Halstead, this is Dr. Richard Haley, Mr. Wyckoff's nephrologist.
Nice to meet you. So you'll handle the red tape?
Absolutely. A VIP room is being prepared for Mr. Wyckoff, as well as our conference room for you to consult with our transplant team.
I'm sorry. What's happening?
Well, I didn't like Brandon's labs. His FOS is up and he's anemic. I'm moving up his kidney transplant to today. I want him to get 2 units of O-neg stat.
Whoa, not so fast. Mr. Wyckoff's my patient. I'll handle his orders.
Dr. Halstead, I appreciate you getting the ball rolling, but Dr. Haley is going to take over.
Ms. Garrett, I am not comfortable with this. Brandon doesn't seem to know anything about his cousin. He's avoiding a paper trail by paying cash, and now some doctor we met 2 minutes ago is rushing him off to surgery? What about repeat labs, pre-op scans, HLA confirmation?
It will all happen. Only now, it's going to take place here instead of East Mercy. An easy and profitable win just fell into our laps, Dr. Halstead. You'd be grateful. We're moving Mr. Wyckoff to the ambassador's suite.
Hey, time? Not yet. Soon. V? Do you understand what's happening?
Oh. Brandon need. I have give.
You have to? Or want to?
I just got word your patient's gonna be admitted and moved upstairs to meet with transplant.
Megs, I need you to stall the transfer. I'm waiting on calls from translators.
You wouldn't dare call me personally on this one. I can buy you maybe half an hour.
That's not gonna do it. Damn it. Okay, let's get a head CT.
Will?
Due diligence. I'm just making sure there's not a delayed subdural hematoma that might endanger V in surgery.
This case smells that funky.
It smells illegal.
Okay, I'll order you the CT. You got an hour now. But if I were you, I'd find a plan B.
Yeah, I need Miss Goodwin.
The black market You think Mr. Wyckoff is buying your patient's kidney?
Wouldn't be the first. World Health Organization estimates that 7,000 kidneys are legally harvested annually. I mean, other reports from human rights groups, economic equality firms. All right. Buyers of traffic organs are high-income individuals from developed countries. The typical seller is male, around 29, and from some of the world's poorest areas. I mean, this is Brandon and V.
Yes, they fit the profile, and I'm well aware of the magnitude of illegal organ transplants, but this is Brandon's file from East Mercy, transplant list status as well as V's donor papers. Our lawyers have been all over these documents. Nothing appears out of place.
What about the nephrologist, Dr. Haley?
Privileges at hospitals across the city, including ours.
So Brandon's covered his bases. That doesn't mean money hasn't changed hands. Ms. Goodwin, I'm telling you, there's something going on here. I have to ask you, is Brandon paying for your kidney? Money. You right? Is Brandon paying you money for your kidney?
No. No money.
It's okay. Just tell me the truth so I can help.
Help. Yes. Brandon.
Uh-huh.
Brandon's sick. I help family.
Dr. Halstead, is there a problem?
No, just checking on V, making sure he's okay.
Me too. Oh, you gotta be kidding me.
Look at us.
My mom took me to Moldova when I was 8. She wanted me to experience the homeland. And village after village, I was so bored. But then on the last day, I met V. And, well, we couldn't speak to each other, but we both knew how to play soccer. So,
Football, no.
Football.
Football.
Thank you for what you're doing for me. You're saving my life. I wish he knew what I was saying.
I think he does. I'll leave you guys alone.
I need to see a psychiatrist now.
Don't listen to my husband, Ben. You're being ridiculous.
Sir, you need to wait for triage.
It's okay, Leah. Hi, I'm Dr. Charles. How can I help you?
Listen, I need to check myself into the psych ward.
No, he doesn't. He's not crazy. Ben, please. People are listening.
Do you think I care? I need to be committed for as long as it takes to stop these thoughts.
Okay, I understand. How about if we step into this room over here so we can discuss your
No, no more talking. I don't need to talk. I need to be locked up.
Ben.
You send me back out of there, then I'm going to murder my wife. Shortly after my wife got pregnant, I started having these thoughts.
Okay, take your time.
It's all right. No one here is judging you.
I'd imagine killing her, slashing her throat with a knife, to be specific. I can't even be around knives anymore, afraid of what I might do.
It must be terrifying. Can I ask you, was this pregnancy planned?
Yes, no. We both wanted it. I don't have an escape fantasy. I'm not jealous of my unborn child.
It sounds like you've been seeing some other therapists.
2. One wouldn't even be alone in a room with me. Thoughts only got worse after that.
I'm really sorry you had to go through that. You know, sometimes when we overfocus on fixing problems like this, you know, not thinking certain thoughts, it tends just to tighten their grip.
Like if I tell you not to think of a brown bear, you'd immediately picture it.
Look, I'm telling you, I'm a real danger. I need to be committed.
It seems to me that Ben is suffering from some sort of OCD. Other than that, he has no functional impairments.
We're not talking about overwashing your hands here or checking the front door every 2 minutes. This is OCD harm. His thoughts toward his wife are violent.
Judging from Ben's history, there's no reason to think he would act on it.
We don't know that. I mean, what if we send him out here today and he does? I really think that committing him is our best option. You know, put him in an environment where he feels safe from his thoughts, help him diffuse them, or at the very least, coexist with them.
What if the right move isn't to make him feel safe from his thoughts? What if it's to make him confront them directly?
You mean exposure therapy? Dr. Reese, I know that's been very helpful to you, but in this case, that approach would be extremely risky and way too early. Like, we need time to fully evaluate the patient. Okay, so let's commit him to the psych ward and take it from there. Okay?
Have a seat, Ben.
Wait, have I been committed already? Shouldn't I be medicated or in a straitjacket or something?
So the nurse is preparing your admittance paperwork, but in the meantime, I would like to talk to you about something.
Talk about what? I already told you. I've done every type of therapy in the book. The thoughts won't go away.
I understand, but what if I told you that most of the thoughts we have are just nonsense, just synapses popping off in our heads, and that we shouldn't take them so seriously? If you could, just do me a favor for a moment. Close your eyes. Now, I want you to bring up the thought that frightens you the most. Tell me what you see. It's okay. You are in a safe space.
I see myself. I'm holding a knife.
Keep going.
I see my wife. She's in the kitchen doing dishes. I'm walking up behind her. She doesn't know I'm there.
You're doing very well.
What's that?
Page Dr. Charles. Let me know when he comes
Kayla,
out here. Here he is.
I got your page. What's up?
It's Dr. Reese. She's locked in with a patient.
You've conquered your fear of holding a knife. A weapon. Now imagine that I'm your wife.
I can't.
You can. I trust you. Do you see her?
Yes.
Here's your opportunity. You can slit my throat right now.
No. I don't want to. I don't want to do it.
No, you don't. This whole time you've been beating yourself up over your thoughts. The fact that you can't dismiss them does not mean you're depraved. It shows you have a conscience.
Dr. Reese, outside, now.
Dr. Charles, I know I didn't take your approach today.
Didn't take my approach? You directly defied my orders and put yourself and your patient in real danger.
Ben isn't dangerous. I think I just proved that.
The only thing you proved to me is that you're reckless and insubordinate, and I have half a mind to suspend you again.
The last few months, you've been preaching to me that I can either see my patients as a threat or as an opportunity. Was I afraid in there? Yes.
But my fear no longer controls me. I control it, and now Ben controls his too.
You are missing the point. I appreciate that exposure therapy has given you a newfound sense of confidence, but it does not make you all-knowing and invincible. What you just did in there was unbelievably stupid.
Julia Dutra, 34, pregnant, power 1, gravity 0, fainted in a yoga class. An AFib at 150, BP 90/60.
Hi, Julia. I'm Dr. Manning. This is Dr. Halstead.
I told him I don't want to be here.
Hopefully this won't take long. On my count. 1, 2, 3.
Julie, are you okay?
I'm fine. Just call Mira.
Our midwife. I think Julie would be more comfortable at home with her.
Sir, your wife's in a dangerous arrhythmia. We can't let her go until we get under control.
Do you have any history of heart disease?
No, I don't eat red meat, and I keep a high antioxidant profile to minimize inflammation.
Okay, good. Let's get an EKG, cardiac lab, CBC, CMP, coags, and a UA, and let's start 5 of Rapamil IV, okay?
No medications.
This one's safe for pregnancy.
If we don't control your arrhythmia, it could put the baby in danger.
Is that true?
Scott.
What? We don't want anything bad to happen.
Okay, fine, but then we're leaving.
Thank you. All right, let me ask you a few more questions.
Wait, what are you doing?
Just a quick fetal ultrasound.
Oh, get that thing off me.
Acoustic radiation impairs neurodevelopment.
That's not actually true. Note that the fetus measures normal size and weight for 5 months.
Wait, what did you say?
That this looks like a normal 5-month pregnancy.
Measure it again.
I'm sure of the numbers.
Well, you're wrong. Measure it again.
See? Totally normal for 5 months.
Except I'm not 5 months pregnant. I'm 8.
Julie's labs.
Anemia, vitamin deficiencies, all the signs of early kidney failure.
And no family history of troubled pregnancies or genetic conditions.
Maybe a malabsorption syndrome?
Miss Dutra, have you ever had any gastrointestinal issues, Crohn's, ulcerative colitis?
I used to have leaky gut. At first, we thought it was just lactose, but of course, it was more complicated than that.
I see. And were you seeing someone for this?
My nutritionist, she got me off lecithin and phytic acid. It helped some, but then once I got pregnant, I had to give up all GMOs and anything that wasn't locally sourced, too.
So what do you eat?
Certain strains of Swiss chard, broccoli. Sometimes I'll have a cup of Adzuki beans.
But she supplements a lot. Selenium, coenzyme Q.
You eat 3 meals a day? More? Less?
I do portion control to manage the baby's glucose. 700 to 800 calories a day. Why?
We suspect the difficulties with this pregnancy are being caused by your diet.
That can't be. I only eat organic.
But you're not getting enough protein or iron.
And we're seeing the effects it's having on your baby. We need to start aggressive IV nutrition to help it grow as much as possible before you deliver. If we admit you to obstetrics now, I understand that you don't want to be here, but at this point,
you're not giving me IV food.
Your baby is severely malnourished.
No, my baby is getting healthy, farm-to-table nutrients. You're not going to pump him full of toxins and chemicals.
Miss Dutra.
I said no.
Your arrhythmia hasn't resolved yet. We'll be back in a minute to check on you.
She's starving that baby to death.
We need to talk to Goodwin. Yeah, your heart isn't responding to the meds. If things keep going in this direction, we may need to consider an emergency C-section to take the extra load off your heart.
Drug me up and cut me open? No way.
That's not what we want either, but we do need to protect you and your baby. That's why in the meantime, if you allow us to give you some IV nutrition...
No way. Those bags off-gas PPAs? Look, you don't get it. This baby is being formed from every single molecule that enters my body. It is my job to keep it absolutely pure. That is how I'm protecting it.
They understand
No,
that.
they don't.
Excuse us. Please tell me you have some good news.
I'm afraid not. The committee ruled that we can't intervene against her wishes, not even for the sake of the baby.
So that's it. We just have to watch as she lets the baby die.
If that's what she chooses to do.
But that's not what she wants. She wants to help her baby. She's just confused about how to do it.
I'm sorry. Our hands are tied.
Mr. Dutra? Hi. I need you to talk to your wife.
She won't listen to me.
But you do understand this has gotten out of hand.
Of course I do. I mean, all she thinks about is how uric acid and compromised soil are infecting everything we eat. What do I say to that?
How did you handle it in the past?
Wasn't this bad before. I mean, she's always struggled with anxiety and control issues. But when she got pregnant, it's like she turned the dial straight to 11. Nothing's pure enough anymore. Everything looks like baby poison.
But there has to be something you can say to get her to let us help.
I am so scared my wife and my baby are gonna die. Can't you do something?
What the hell are you trying to do to me?
Please, Miss Dutra, let me
I told you no food!
Just 1 second.
What's going
I need
on?
you to calm down, okay?
She put my IV behind my back.
Miss Dutra, wait.
Glucose, amino acids. You did this?
First place.
Miss Dutra? Miss Dutra, please.
Dutra, just relax.
Miss Dutra, we need to get you back into bed.
Get her away from me! Get her away from me!
I need some help here. All right, easy. Relax, I have her. Just get her back up.
You're very lucky her husband convinced her not to pursue action against you or the hospital.
Miss Goodwin, I'm sorry.
I expect better from you, Dr. Manning.
Nat, wait.
I'm sorry.
I'm really not interested.
I understand. If you didn't trust us before, you certainly have no reason to trust us now.
Then we finally agree on something.
Julie, fearing for your baby's safety is the most natural thing in the world. When I was pregnant, I lost my husband. I was afraid of a lot of things. And then one day, after I had my son, I was up in a high-rise building on the balcony and suddenly had this vivid image of myself falling over the railing. And my first thought was what would happen to my son if I wasn't here for him. And the craziest part is that my favorite thing in the world had always been Ferris wheels and roller coasters and being up in the air. But from that day on, I had this totally irrational fear of heights. It is really scary being solely responsible for that tiny, defenseless person inside of you. But you are letting your fear win. And it's gonna end badly. Anyway, I am sorry.
Dr. Halstead.
Her heart rate's too high and her pressure's dropping.
Baby's heart rate's down to 90.
It just hurts.
Your arrhythmia is escalating out of control. Push 10 milligrams of diltiazem stat and upper O2 to 6 liters.
We need to do a C-section. We have to get the baby out.
No.
Julie, I know you don't trust me, but your baby is in real danger.
84?
Julie, let them do it.
I can't.
Julie, if you don't let us do this, your baby is going to die.
You can't do it.
Thank you.
Call Abby and tell him we're coming up for a crash C-section now.
You heard her, let's move.
How are you feeling?
I'm okay. What are they putting in him?
Proteins, carbohydrates, fats. He needs them.